Hello, everyone, and welcome to the COVID Scams in Older Adults webinar. My name is Chantel Virgil, and I am a Consumer Educations and Outreach Specialist at the Federal Communications Commission, Consumer and Governmental Affairs Bureau. But most importantly, I will be your moderator for this webinar today. So again, welcome. In today's webinar, we will discuss ways to avoid COVID-related scams, especially new scams related to COVID vaccines. You'll also hear tips and resources to help protect your finances and guidance on what to do if you ever become a victim of a scam. Most of this information will be directed towards older adults. However, this webinar will have tips and resources we all can use to protect ourselves and information we can share with others in our family and our communities. If you have any questions at any time during this webinar, please send your questions to outreach@fcc.gov. Also, it may be helpful to know that the presentations from this webinar will be available on the FCC's events page at www.fcc.gov/outreach. You will hear from three organizations today. They are the Federal Communications Commission, the Consumer Financial Protection Bureau, and the Department of Health and Human Services. But before we get started with their presentations, we will have opening remarks from Patrick Weber. Patrick is a veteran communications attorney with more than 25 years of government and private sector experience. As chief of the Consumer and Governmental Affairs Bureau of the FCC, he oversees the development and implementation of consumer and disability-related policies, consumer education, complaints, and outreach to state, local, and tribal governments. Patrick, you can unmute yourself.
Thank you, Chantal. On behalf of the FCC and our co-presenters from the Consumer Financial Protection Bureau and the Department of Health and Human Services Administration for Community Living, I'd like to welcome you to our COVID-19 Scams and Older Adults webinar. News of the ongoing COVID-19 pandemic is everywhere. It continues to impact our daily lives and the lives of our families, neighbors, and friends. The recent focus has been on vaccine deployment and availability. One thing we know is that when there is a subject that dominates the news, it is often an invitation for scammers and fraudsters to deploy schemes to try and steal money and personal information from consumers. We've all gotten calls that offer a free vacation, threaten arrest if a payment is not made immediately over the phone, or seek to verify some personal information to activate new medical coverage or other claimed benefits. Most of us quickly realize that they are an annoyance and that we just hang up. But the confusion of a global pandemic has created an opportunity and an opening for fraudsters. These people thrive when information and advice is evolving and seek to exploit our fears and our anxieties. Early COVID-19 scams offered fake test kits or special supplies for diabetics, a group known to have more complications from COVID-19. Scams then shifted to focus on the economic uncertainty the virus was causing. Scammers took advantage of the stimulus program to swindle consumers. Even our top unwanted call complaint of 2020, which is auto warranty renewal calls, was modified to reference financial uncertainty resulting from COVID-19. As vaccines are being deployed, scammers have once again pivoted their messaging. State and local governments have rolled out plans to provide the vaccine to their communities. Different areas have different plans and procedures for ensuring their residents get vaccinated. In many areas, demand is outpacing supply and appointments are difficult to make. Based on guidance from your local health department, you may need to pre-register or wait for a callback before being able to make your appointment. Older adults are being prioritized for vaccinations, and while they are not necessarily the group that is most likely to be scammed, that honor, if you could say honor, belongs to 18 to 25-year-olds, according to recent studies. But older adults do tend to lose more money when they are scammed. Those larger losses are amplified by fewer opportunities and less time to recover from the loss. Being cheated out of large sums of money is life-changing for anyone. We at the FCC have seen and heard about these losses firsthand during our rural tours, a series of meetings and public events in rural areas throughout the country. During a tour through Appalachia prior to the pandemic, in meeting after meeting with small town police chiefs, sheriffs, and other community leaders, they all knew someone who had been scammed. Stories like a widow who had her late husband's life insurance money stolen, or others who had lost tens of thousands of dollars due to scams, which oftentimes started with a simple robocall. Sadly, that was not unique to our Appalachia tour. We hear these stories whenever we've met with consumers or local leaders. Too often, these scams start with a robocall. In response, the FCC is working hard to prevent unwanted and illegal robocalls and text. In recent years, we've taken steps to empower telephone service providers to block illegal and unwanted types of robocalls. We've also reduced the number of calls previously allowed under exemptions to the Telephone Consumer Protection Act. We've instructed telephone service providers to deploy caller ID authentication technologies, which will help to restore trust and accuracy to the caller ID information being displayed on your phone, as well as facilitate the blocking and tracing of unwanted calls. We have further required all voice service providers to take steps to stop illegal traffic on their networks and assist the Commission and law enforcement authorities in tracking down callers that make these calls. We have issued our largest fines ever against robocallers violating FCC rules. And with events like today's webinar, we are working to educate consumers about scams, spoofing, and ways they can reduce unwanted calls. Educating consumers about these scams and how they can protect themselves is more effective when we work together. FCC partners such as the two you will hear from today are critical in helping us spread the word. I invite you to share the tips and resources you learned today with others in your circles. Together, we can help others avoid scams. In today's webinar, the FCC, the Consumer Financial Protection Bureau, and the Department of Health and Human Services Administration for Community Living will discuss COVID scams and their impact on older adults. We will walk you through the life cycle of a scam. Along the way, we will discuss tips to avoid being scammed. The FCC will discuss how scams first reach consumers, often through robocalls and texts, and share tips on how to protect yourself from becoming a victim of COVID-19 related robocalls and text scams. The Consumer Financial Protection Bureau will discuss COVID-19 scams that are currently circulating via phone, email, or the web, other financial scams targeting seniors which can be easily deployed during the economic fallout of the pandemic, and information on options and strategies for seniors to employ if the pandemic has created financial hardships for them and their families. And finally, the Administration for Community Living will discuss a number of related federal offices and resources poised to advocate on behalf of seniors, particularly those who are targeted by scammers seeking to exploit the ongoing pandemic with misinformation and fraud. As Chantel mentioned, all the information and resources we share from today's presentation to protect yourself and your loved ones will be posted on www.fcc.gov under the events section in the next day or two. One final word specific to vaccines and the environment being ripe for scams. In addition to the information we share today, please note that some of the best resources for guidance and answers to your vaccine questions are your state and local health departments or your healthcare providers. These resources can provide important information on where to find COVID testing sites and your state's plans for distribution of the COVID-19 vaccine. Again, thank you for joining us today. Now let me turn the floor back over to Chantal, who can kick off our program. Chantal.
Thank you, Patrick. We'll begin our presentations with Ed Bartholomew, Associate Bureau Chief of the Consumer and Governmental Affairs Bureau at the FCC. Ed currently oversees the Bureau's outreach, education, and consumer complaint teams. Prior to joining the FCC, Ed spent 10 years as the Executive Director of Call for Action, a national nonprofit that partnered with media outlets to provide consumer education and mediation services. Ed, you can unmute yourself and turn on your camera.
Thank you, Chantal. As Chantal mentioned, I'm Ed Bartholomew, an Associate Bureau Chief, Consumer and Governmental Affairs Bureau here at the FCC. That's a really long title that means I help lead our consumer complaints, education, and outreach efforts. Next slide, please. Today, I'm going to share some examples of COVID-19 related scams we've been tracking in recent months, including some of the emerging vaccine scams that we're now becoming aware of. I will also share a number of helpful links and resources where you can learn more and report scams. Next slide, please. Robocalls are made with an auto dialer or using a pre-recorded or artificial voice. Advances in technology have made it cheap and easy to place a large number of auto-dialed calls. It's important to remember that not all robocalls are illegal. Reminders about your prescriptions, changes in your flight status, and other important information is often delivered with legal robocalls. As Patrick shared earlier, the FCC has been working hard in recent years to protect consumers from unwanted and illegal robocalls, while ensuring that they continue to receive the calls they want. Another tactic used by robocallers is spoofing. It occurs when a caller deliberately falsifies the information transmitted to your caller ID display to disguise their identity. Spoofing someone else's phone number is illegal when it's done with the intent to defraud, cause harm, or wrongfully obtain anything of value. Again, keep in mind that not all spoofing is illegal. Your doctor may call back a patient from their personal number, but want to display their office number and information on the caller ID. You can learn more about spoofing and see an animated video on the subject at www.fcc.gov/spoofing. Another great way to stop legitimate telemarketers from calling is to register your phone numbers on the Federal Trade Commission's Do Not Call registry at www.donotcall.gov. If your number's registered and you get a sales call from companies you currently don't do business with, they're violating the law and you should just hang up. Next slide, please. Now that you know a little more about the tools scammers are using to contact you by phone, let's talk about some of the COVID-19 scams we've been tracking during the pandemic. Here's audio from one of the early phone scams we saw. It offers phony at-home test kits. Please play the audio.
Response Act has made coronavirus testing more accessible immediately. If you want to receive a free testing kit delivered overnight to your home, press 1. If you do not want your free testing, press 2. Response Act.
Next slide, thank you. Scammers are using text messages as well to con consumers. In the fall and heading into the holiday season, we saw a rise in package delivery text message scams. Americans were ordering more items online and sending gifts to loved ones that they may not be able to visit during the holiday season. For many, a notice about a package they didn't expect or forgot they had ordered seemed plausible, but the links lead to phishing sites designed to impersonate real package delivery companies and requesting personal information or payment in order to deliver the bogus package. Next slide, please. As Patrick mentioned, we've seen COVID-19 related scams and tracked them closely, and they follow the news cycles. Early scams focused on testing and supplies, and those have continued. Consumers should watch out for calls from fake pharmacies offering pre-approved medications or supplies. The caller often claims the cost of the medications are covered by insurance, but they need additional information to process shipments. Scammers may even pretend to represent legitimate insurance companies. If you receive a call from someone claiming to be from your insurance company, hang up and call the number on the back of your medical insurance or prescription card to confirm whether the call is legitimate. The second round of COVID-19 scams that we saw really preyed on financial fears and stimulus programs, and my fellow presenters today will cover some of those in more detail. Of course, any emergency or disaster leads to a spike in charity scams. Always check on a charity by calling or looking at its actual website before donating, and be cautious of social media pleas for donations. We also tracked a rise in contact tracing scams as state and local governments began efforts to contain the spread of the virus using contact tracing. One trend we've seen involves the use of peer-to-peer mobile payment apps. These are becoming a favorite of scammers as they look to offer a contact-free way to send money during the pandemic. The scammer gets a fast payout and consumers are left with little recourse. Before using a peer-to-peer app, review the app's fraud protection policies and understand if and how you can recover funds should a problem arise. Next slide, please. Scammers are also trying to capitalize on the rollout of vaccines. Vaccination plans will vary across state and local governments. Check with your state or local health department to learn when and how to get the COVID-19 vaccine. You can also talk with your healthcare provider, pharmacist, or health insurance provider to learn more. We're just starting to hear reports of scam callers impersonating local health departments and vaccine providers and asking consumers to provide personal information in order to make or confirm a vaccine appointment. There are also reports of people offering to sell vaccines and trying to obtain emptied vaccine vials that they can reuse and resell to unsuspecting consumers. Some tips to keep in mind when it comes to COVID-19 vaccine scams. Anyone who asks for payment to put you on a list, make an appointment for you, or reserve a spot in line is a scammer. Ignore sale ads for the COVID-19 vaccine. You can't buy it anywhere, including online pharmacies. The vaccine is only available at federal and state approved locations such as vaccination centers. Watch for unexpected or unusual texts. Don't click on links in text messages, especially if you didn't expect to get the message. If your healthcare provider or pharmacist has used text messages to contact you in the past, you might get a text from them about the vaccine. If you do, contact that provider or pharmacist directly to make sure the text is legitimate. And don't share your personal information, financial, or health information with people you don't know. No one from a vaccine distribution site, healthcare provider's office, pharmacy, health insurance company, or Medicare will call, text, or email you asking for your social security number, credit card, or bank account number so that you can get the vaccine. Next slide, please. I also want to share some more general tips today that will protect you from all robocall and text scams, not just those related to COVID-19. Don't answer calls from a number you do not recognize. Let it go to voicemail and call back if you need to. If you do answer and it's not who you expected or someone trying to sell something or collect information, don't hang on, hang up. It's never rude to hang up on a scammer. If you pick up the call and you're asked to press a button to stop getting calls, hang up. It won't reduce the number of calls you get, and sometimes it may actually increase the calls you get. Never provide personal information such as date of birth, account numbers, social security numbers, passwords, mother's maiden name, or other identifying information to someone that calls you. Next slide, please. If you receive an unexpected call from someone claiming to be from a company or agency, asking for personal information, hang up. Look up the number on their website, a recent account statement, or the phone book. You can always call back once you've verified you have a good, valid working number. Scammers thrive on creating high-pressure situations. You have to act now. I need immediate payment or we'll cut off your power. If a caller tries to pressure you, hang up, do some research, talk to family and friends. If you still have a concern, once you've found that valid, legitimate number, you can call back and find out if there really is a problem that needs your attention. Ask your service provider what call blocking tools they offer and check to see what apps may be available for your mobile device. To see more information on robocalls, you can visit fcc.gov/robocalls. Next slide, please. If you believe you've been a victim of a COVID-19 scam, report it to the Federal Trade Commission online at reportfraud.ftc.gov. To file a complaint regarding COVID-19 robocalls or text scams, visit the FCC's Consumer Complaint Center at consumercomplaints.fcc.gov or call 1-888-CALL-FCC. That's 1-888-225-5322. The FCC also takes complaints over our American Sign Language support line at 1-844-432-2275. Next slide, please. To access consumer guides on various topics, visit the Consumer Help Center at fcc.gov/consumers. For information specifically about COVID-19 scams, visit fcc.gov/COVID-scams. To learn more of the work that our Consumer Affairs and Outreach Division is doing, you can visit fcc.gov/outreach, or you can email the team at outreach@fcc.gov. We also have an American Sign Language version of our COVID scam guide available in our ASL video library at fcc.gov/ASL-video-library. Requests for information in accessible formats such as Braille, large print, and screen reader friendly versions can be sent to FCC 504@fcc.gov. Next slide, please. You can also find descriptions of over 50 different phone-based scams on the FCC's scam glossary at fcc.gov/scam glossary. And we're always adding new scam entries, so stop back frequently to see what else is happening out there. Next slide. In conclusion, our best advice remains don't answer calls or texts from unknown numbers. And with that, I'll send it back to you, Chantel.
Okay, thank you, Ed, for that information. I think all of our viewers get an idea of just how many resources we have for them. So I just want to reiterate that you can find these presentations, or you will be able to find these presentations at the end of our webinar. Just go to www.fcc.gov/outreach, okay? All right, so next we'll hear from Lisa Schifferly. Lisa is a senior policy analyst in the Consumer Financial Protection Bureau's Office for Older Americans. She has over 20 years of consumer protection experience, including almost 12 years as an attorney at the Federal Trade Commission and 8 years at the Maryland Legal Aid Bureau. Lisa, you can unmute yourself and turn on your camera.
Thanks, Chantel, and hi, everyone. My name's Lisa Schifferly, and I'm a senior policy analyst in the CFPB's Office for Older Americans. Thanks for inviting me today to talk about COVID scams, older adults, and financial protection. I'm going to describe some of the scams that we're seeing and then tell you about some CFPB resources that we hope will help you avoid and respond to COVID scams. Next slide, please. Before we begin, I have to give this disclaimer, which just says that anything I say is my opinion and not necessarily the opinion of the Bureau. And on the next slide, if you're not familiar with the CFPB, we are a national consumer protection agency, and I work in the Office for Older Americans, where we develop resources both to help protect older consumers from financial harm, and also to help older consumers make sound financial decisions as they age. And you can find all of our materials that I'll talk about today at consumerfinance.gov/older-Americans. Today, I'm going to focus on some of our COVID-related resources for older adults. And let's start with the scams we're seeing. The main one that we're seeing right now, as Patrick mentioned and as Ed mentioned, is COVID vaccine-related scams. The news is all about COVID vaccines right now, where to get them, how to get them, the shortage of them, and with the difficulty of getting the vaccine, scammers are trying to lure people in with promises of early access. So, as Ed mentioned, to avoid vaccine scams, here are a few tips to share with other people. First, don't pay for promises of early access. That's a scam. Also, don't give personal information like social security numbers, bank or credit card numbers to someone who promises to get you a vaccine for a fee. You might have to give your Medicare number when you go in and get the shot, but you shouldn't have to give bank or credit card information in advance to sign up to get a vaccine. And remember, if you are on Medicare, then the vaccine is totally free. So for most older adults, there should be no cost whatsoever. For other people, the vaccine itself is free, but there may be an administrative fee for administering the shot. Some insurance plans are covering the admin fee too, but for older adults on Medicare, the vaccine is totally free. Now on the next slide, I want to talk to you about some other coronavirus-related healthcare scams. One of them relates to test kit offers. And the FDA has now authorized some home testing kits. We used to say that all of those were scams, but now there are some legitimate home testing kits. But you still need to be aware that there are scammers calling people posing as Medicare reps and asking for social security numbers in order to send you what they say is a free home test kit. That's a scam. It's better to check with your Department of Health for legitimate testing centers. We're also seeing scams related to air filter systems where people claim that these air filters will remove COVID-19 from the air in your home. So if you get a phone call, email, text message, or letter with claims to sell you any type of air filter system to take COVID out of your home, that's a scam. Also want to talk about contact tracing scams. On the right-hand side, you'll see an FTC infographic that talks about contact tracing scams. And what's going on is that scammers are pretending to be contact tracers in order to get your personal information. They say, they call you usually and say, sometimes they may text too, but they say you may have been exposed to someone who tested positive for COVID, and then they ask for your personal information or for your money. So to spot a scam, keep in mind that real contact tracers will not ask for money. They will not ask for your social security number or your bank or credit card numbers. They also won't ask your immigration status. Next slide, please. Government imposters is another type of scam that we're seeing a lot of during the pandemic, and they come in a few different varieties. If you're on Social Security or Medicare, you might get calls that claim to give you special access to testing or treatments, but those are scams. Social Security and Medicare are not offering special access to tests or treatment. So spread the word that if you get a call like that, please just hang up. There are also scams related to economic impact payments or EIPs and even to COVID-related unemployment benefits. Scammers may call asking for personal information, saying they're going to expedite your EIP payment. Also, we've heard that some older adults report getting prepaid cards in the mail for unemployment benefits that they did not apply for or sometimes do not qualify for. And in fact, the FTC has reported that ID theft complaints doubled between 2019 and 2020. So at least part of that is due to an increase in unemployment and EIP-related identity theft. Now this slide shows some tips to avoid government imposter scams. First, keep in mind that the government will not call about expediting your EIP. That's a scam. Also, if you need to go to a government website, it's better to visit it directly by typing the name into your browser rather than clicking on links in text or emails, because those can download malware. Also, remember that the government will not ask for cash, gift cards, wire transfers, cryptocurrency, or other personal financial information. So hang up on those scam calls as well. On the next slide, you'll see errand helper scams. This is a new scam that's emerged during the pandemic that especially affects older adults or other people who may be trying to reduce their exposure to the virus by staying indoors. They may hire errand helpers to go to the store and do errands for them. And then, unfortunately, these errand helpers run off with the money and don't actually do the errands. So we advise older adults who need help to try to find a trusted friend or neighbor. And if they're shopping online, to try to use a trusted seller. And if you're a caregiver for someone or just have an older person in your life, to check in with them regularly by phone or video to look for warning signs of scams. And Hillary's going to talk to you more about resources later, but if you do need help finding help, trusted help for errands, you can turn to the Elder Care locator at eldercare.acl.gov or 1-800-677-1116. Now, on the next slide, I'm going to talk to you about some of the financial impact of the pandemic. We've been talking so far about scams, but I want to also let you know about some CFPB resources for people who are having trouble paying bills during the pandemic, which is a lot of people right now. So if you can't make a payment right now, or if you need more time or want to discuss payment options, it's really important to contact lenders and servicers to tell them about your situation. They're not going to automatically reach out to you and offer you a COVID-related deal, but many credit card companies and lenders may be able to offer you a number of options to help you that could include things like waiving ATM fees, overdrafts, late fees, as well as allowing you to delay, adjust, or skip some payments. So you need to reach out to them if you're having trouble making the payments, and be prepared to explain things like your financial and employment situation, how much you actually can pay right now, and when you think you'll be able to restart your regular payments. And you will have to let them know, well, it's probably going to help you if you let them know that you are experiencing financial hardship due to the COVID-19 emergency. Now, on the next slide, I'll talk to you about some mortgage relief options. And I'm going to talk about some of the CARES Act mortgage relief options, as well as others that have been extended by federal agencies. But I want to let you know that for a deeper dive, you should visit our housing hub, which is at consumerfinance.gov/housing. It includes this video that you see here that explains a lot about forbearances and other mortgage relief options. Now, on the next slide, I'll tell you a bit about what some of those options you are. But first, let me say that if you can pay your mortgage, you should continue to pay your mortgage. But if you cannot pay your mortgage or can only pay part of it, it's very important to contact your mortgage servicer immediately to try to deal with this. There are two protections for homeowners right now who have federally backed mortgages. And if you're not sure if your mortgage is federally backed or not, you can go to our website, consumerfinance.gov/housing, and it has a tool to help you find out whether your mortgage is federally backed or not. But the first tool you have for federally backed mortgages is a foreclosure moratoria. So if your loan is backed by Fannie Mae or Freddie Mac, then they can't foreclose on you until after March 31st of this year. And if your loan is backed by HUD, FHA, USDA, or VA, then they can't foreclose on you until after June 30th. So there's those foreclosure protections, and some states have additional protections as well. So you should check with state law as well. There's also a forbearance option. You have a right to a forbearance, which is when your mortgage servicer or lender allows you to temporarily pay your mortgage at a lower payment or pause paying your mortgage. And with the COVID-related forbearance, there's no additional fees, penalties, or interest beyond the scheduled payments. So with the forbearance under the CARES Act and these extensions, which have recently been made by federal agencies, you are able to have up to 15 to 18 months of mortgage forbearance, depending on what type of loan you have. And if you're at the end of your original 180-day forbearance, then we do encourage you to contact the servicer to request an extension. And you can go to consumerfinance.gov/housing to get additional details about the deadlines and details about how to request that. Now on the next page, I just want to explain a little bit more about a forbearance because that term may be unfamiliar to some people. Forbearance, like I said, is when your mortgage servicer or lender allows you to temporarily pay your mortgage at a lower payment or stop paying back your mortgage for a period of time. It's not a free ride. You do have to pay back the payment reduction or the pause payments later. But it can help you deal with a hardship such as the COVID pandemic and job loss. So it is important, though, to remember that it doesn't erase the amount you owe on your mortgage, and you will have to repay any missed or reduced payments in the future. Also good to know that there is no documentation of hardship required, so people shouldn't be intimidated by that. You just have to tell them that you are having a hardship during COVID, but you don't have to provide documentation to prove that. Now on the next slide, we'll talk a little bit about dealing with debt, because there's a wide variety of different debts that people may be dealing with right now. So if you currently do have a debt in collections, we have some tools available at consumerfinance.gov/consumer-tools/debt-collection. But it's also important to know your rights right now. And there's a law called the Fair Debt Collection Practices Act, which makes it so that a debt collector cannot use unfair practices to collect a debt. So that means they can't do things like misrepresent the debt, including the amount owed. They can't falsely claim that the person contacting you is attorney. They can't threaten to have you arrested. And they can't threaten to do things that cannot legally be done or threaten to do things that they have no intention of doing. And they're basically not allowed to harass you. So it's very important to know those rights because for a lot of people, the stress of getting those harassing debt collection calls can be as difficult as the debt itself. Also remember that when you're trying to settle your debt, be cautious about debt settlement companies. Sometimes you may end up owing more by working with an illegitimate debt settlement company. So it's important to work with a legitimate credit counselor when you're working out your debts and repayment plans. And we do have more tools for that on the website listed on this slide. Now on the next slide, I want to talk about protecting your credit, which goes hand in hand with the debt issue. During the pandemic, and really any time, you should be checking your credit regularly. But during the pandemic, with the recognition that a lot of people's credit may be changing, due to COVID, you can actually get free weekly credit reports until April 2021 at annualcreditreport.com. Normally, you can get one free report from each of the 3 credit reporting agencies, Equifax, Experian, and TransUnion. But right now, you can get them free every week instead of one free per year. So it's important to check your credit because if you do work out a forbearance or another deal related to COVID, then that is supposed to be noted on your credit. So you should check your credit, make sure that it actually reflects any agreements that you've worked out and that it's not showing that you're a delinquent if you were not delinquent and worked out a repayment plan. So check the credit and if necessary, file a complaint, and I'll talk to you more in a minute about how to do that. But I do want to first tell you about some of the other resources we have at the CFPB on the next slide. And the slide after that, you will see consumerfinance.gov/coronavirus. This has all of our coronavirus related content. It has credit and debt management, student loan repayment, mortgage relief options, scams, online and mobile banking tips, and a guide about your EIP payment. So there's a lot there, and it's available in Spanish as well as some other languages listed on this slide. On the next slide, you will see our housing website, which I talked about before. This is the one that you will find at consumerfinance.gov/housing. It was done with other federal agencies to let you know what your options are for mortgage relief and also renter protections if you are a renter who's affected by the pandemic. On the next slide, you'll see we have a series called Money Smart for Older Adults. This is one of our flagship programs that we've had since before the pandemic. And it's an awareness program we developed with the FDIC. It focuses on preventing elder financial exploitation. And if you're someone who gives trainings in the community, it's a plug and play training. We have an instructor guide that scripts a presentation, a slide deck, and a participant resource guide. So you can find the information about ordering this at consumerfinance.gov as well. And also for fraud prevention, on the next slide, you'll see our fraud prevention placemats. We started these originally designed to be used by meal delivery programs as placemats with fraud prevention messages, but we found that so many people love them and were ordering them to use as postcards and activity sheets that we've expanded them. And they cover topics related to romance scams, tech support scams, online safety, and a whole lot more. You can find those at consumerfinance.gov/placemats. I also want to let you know about our Managing Someone Else's Money guides, because right now, millions of Americans are managing money or property for someone who's unable to do so. Next slide, please. And with the coronavirus pandemic, more of us may be called upon to act as financial caregivers. So the CFPB has 4 different guides to help family members and friends who are financial caregivers. And you can find them at consumerfinance.gov/MSEM. And on the next slide, I just want to let you know if you do have a problem with a financial product or service, we do encourage you first to try reaching out to the company, and companies may be able to answer questions unique to your situation. But if that does not get you a resolution that you want, then please do file a complaint at consumerfinance.gov/complaint. Most companies respond to the complaints filed there within 15 days. The company may contact you directly to confirm information provided in your complaint before it responds, but you will get a response from the company by submitting a complaint online to CFPB at consumerfinance.gov/complaint. So I just want to remind you also to check out consumerfinance.gov/coronavirus for all the information that I've covered today and a lot more about coronavirus related scams. So thank you all for listening today. I hope everyone stays well, and I'll turn it back to Chantel.
Thanks, Lisa, for that information. I especially love the placemats idea. That was a good one. All right, so Hillary Dolan will give our final presentation. Hillary Dolan is the Director of the Office of Elder Justice and Adult Protective Services at the Administration for Community Living in Washington, D.C. The office coordinates and manages a federal strategy for elder justice, coordinates adult abuse and response, supports elder rights and legal assistance programs, pension counseling and assistance programs, as well as works closely with ACL's Office of Long-Term Ombudsman Programs. Previously, Hillary was with the Department of Health and Human Services Centers for Medicare and Medicaid Services. Prior to joining the government, she was a legal assistance attorney and manager in older Americans' offices for many years. She also served as ombudsman, legal backup, and trainer in several states, and has taught elder law and health law at a number of law schools. Hillary, I see that your screen is up and you can unmute yourself.
Okay, thank you very much, Chantel. Thank you to my fellow speakers for that wealth of information. And thank you to everybody who is joining today. This is such important information to get out. So I am going to talk about how the aging and disabilities networks can help individuals to assert their rights and protect themselves from all of these terrible scams and frauds that my fellow presenters have described to you. But first, I want to just tell you a little bit about the Administration for Community Living. Next slide. Our fundamental principle is that all people, regardless of age or disability, should be able to live independently and participate fully in their communities. We fulfill this vision by advocating across the federal government for older adults, for people with disabilities, their families, and caregivers. We do it through funding services and supports that are primarily provided by networks at the local level of community-based organizations, and by investing in training, education, research, and innovation. These are the ways in which we help make this principle come alive and be a reality for millions of Americans. Next slide. So in general, I want to emphasize, and I think all of my colleagues from the Aging and Disabilities Networks who are joining us in this webinar will recognize these fundamental activities that are incumbent on all of us in the face of all of these scams and frauds around COVID, and right now around the vaccine, given that it's in scarce supply at the moment. First of all, to learn as much as possible about these scams and frauds and about the remedies for older Americans and Americans with disabilities. And in this regard, really want to thank the FCC and the CFPB and all of the other member agencies of our Elder Justice Coordinating Council, which brings together 16 federal departments, all of whom have a stake in elder justice, for all of the educational work that you're doing, as well as the work to identify these scams and frauds and the bad actors who perpetrate them, bring them to justice, and help to keep all of us safe from these kinds of activities. Secondly, to educate constituents about how to avoid these scams and frauds. And we got a lot of information today about how to do that can be shared, and lots of information from FCC and CFPB that you can share with the people for whom you care about and those with whom you work. Next is encouraging and insisting with reportings and assisting with reporting scams and frauds to appropriate law enforcement agencies, including the two with whom I'm presenting today. This is very important, and we'll talk a tiny little bit more about that in a little bit. And finally, referring people to components of the Aging and Disabilities networks that can directly help individuals. And we're now going to spend the next few minutes walking through a tour, if you will, of some of those network resources. Next slide. So the first one I want to talk about are area agencies on aging, or AAAs. These are private, they're public or private nonprofit agencies that are designated by a state aging unit to address the needs and concerns of older persons at a regional or local level. But I would not suggest going looking for your area agency on aging. Many are called that, but they have lots of different names. Lisa already mentioned the Elder Care Locator. I am going to promote it again in just a few moments as the way to find your area agency on aging if you're not already connected up with them. Because area agencies on aging coordinate to offer services, an array of services that help older people to remain in their homes with services they need, and to arrange for whatever it's going to take to make independent living a viable option. They are a great source of education and information and referrals on COVID vaccines, and the truth, as well as the misleading and downright fraudulent and false information that the scammers and fraudsters are trying to perpetrate on all of us. Next slide. Adult protective services are available in every state and all 6 territories. So that includes DC, which technically is a territory, not a state. and also the other 5 territories that comprise the United States. There's an adult protective services program in each and every one of them. They investigate abuse, neglect, and exploitation of older adults, and in most states, adults with disabilities. As the slide says, each state has its own kind of jurisdictional guidelines about the people they work with and the services they provide, but generally speaking, the populations served by adult protective services include either all adults or adults with a disability or what is called a vulnerability in some state statutes, and adults under 60 or in some states 65 with a disability as defined by state statute. Next slide. As you can see from the definition of what adult protective services do, they are very involved in the investigation and remediation of encounters that adults can unfortunately have with these kinds of scammers and fraudsters. They provide education, just like many of the other resources we've heard about in this webinar. Most notably, however, they can assist in removing the authority of third parties who improperly got that authority to handle finances. Now, the example here is a power of attorney, but it really can be any financial document that is fraudulently obtained from someone. Adult protective services can be the point of entry for actions to remove improperly imposed authority and get the control back into the hands of the individual. And as I said, it could be a power of attorney, could be a joint bank account, could be guardianship. Adult protective services will help with that and will assist and empower individuals to find trusted decision supports as appropriate to help avoid further unfortunate encounters of this kind. Next slide. So specifically with respect to COVID vaccine scams, if the exploitation results in hardship, such as the person can't get food, can't pay the rent or the mortgage, can't pay essential bills, can't pay for or access health care because of the harm that's been done to them by the COVID scam or fraud, APS can be the bridge to needed services and has relationships to all of the community services that can help set things straight. Next slide. So now I'm going to move on and talk about legal assistance, sometimes called legal aid or legal services. While I'm going to be describing the legal assistance that we in the Administration for Community Living fund under the Older Americans Act, there are other kinds of legal services as well. And in this instance, they will more or less all do the same thing as they help to help individuals to restore their losses. So they can, first of all, help with the immediate protections, the reporting of unauthorized use of credit or debit cards, placing of fraud alerts and credit freezes. They can also, I'm just going to say a couple of things before I go on to the next two bullets there. They can also utilize civil legal remedies to resolve losses to the extent possible, such as remediating identity theft, assisting in civil actions to restore money that was stolen from bank accounts or debt run up on a credit card, and addressing the adverse impact on entitlements benefits that might result from the draining of bank accounts and the running up of debt, such as restoring eligibility for Medicaid, supplemental security income, supplemental nutrition assistance. They can also work with Social Security to make sure that the right person, the individual, and not some bad actor is getting a Social Security benefit. And in addition, They can assist with the reporting of fraud to my colleagues from the FCC, the CFPB, and other federal agencies that are enforcement agencies with authority to actually take out the bad actors. Very, very important. Legal assistance attorneys very often use the Elder Justice Toolkit, which was created by us and our National Resource Center, the National Center on Law and Elder Rights. It is a step-by-step guide to identifying problems, responding to individuals in trauma-informed, culturally sensitive and fluent ways, and identifying all of the remedies that a legal aid lawyer can bring to bear to restore someone to their state from before they were adversely affected. Next slide. SMP, or Senior Medicare Patrol, is another one of our programs, and it is available in every state. And they educate and assist Medicare beneficiaries, their families, their caregivers, and their communities to prevent, detect, and report suspected healthcare fraud, as many of the current frauds and scams are around COVID. They do this through outreach, through counseling, and through education, and through assistance with actually making the reports to the appropriate authorities that respond with enforcement against healthcare frauds. Next slide. Long-term care ombudsman program. This is another of our programs at ACL that in general supports the quality of life and rights for people who live in long-term care facilities. They advocate, they are available in every state. This is a program that aims to place an advocate, either a volunteer or a staff advocate, very well trained, into every congregate long-term residential facility in the country. Those advocates are there for the residents. They are a trusted source of factual information, and they are well connected to local resources. So you can see where they too can be a resource for residents of congregate long-term residential settings to help them avoid, and if they fall for, respond to and recover from these COVID-related scams and frauds. Next slide. Going to end my tour of community resources with two that are specifically for disabilities that are part of our Disabilities network. Centers for Independent Living work to support community living and independence for people with disabilities. And they provide tools, resources, and supports to integrate people with disabilities fully into their communities to promote equal opportunities, self-determination, and respect. So it goes without saying that educating and advising on COVID vaccines, the facts about COVID vaccines, particularly as people with disabilities in many states are being prioritized for vaccine administration. It's very important to help separate the facts from the frauds so that people can get their vaccines and not fall victims to the fraud. And finally, next slide. Protection and advocacy. There's a protection and advocacy program in each state, and they are akin to legal assistance and also akin to investigation of complaints. So they help individuals with disabilities to exercise their rights, to make choices, to contribute to society, and to live independently. They engage in lots of efforts to also promote the rights of people with disabilities, and therefore, again, they are a resource for providing information and referrals and dealing with COVID vaccines, the facts, and also COVID vaccine scams. Next slide. Okay, finding help. And here you see, back to Lisa's promotion of the Elder Care Locator, I've got it too. Because this is one centralized location on the web or available by calling an 800 number that can connect individuals to local resources of the kinds that I just described. And while the name says Elder Care Locator, they have resources for all adults, including adults with disabilities. And then I've got some more specific links to help to locate the local resource with all of the other programs that I spoke about. So next slide. In summary, what we want to do is to partner across the federal government, coordinated through our Elder Justice Coordinating Council, with whom I work and support that council along with my colleagues at the FCC and the CFPB, who are members, to support state and community efforts in regards to abuse, neglect, and exploitation of elders, including these scams and frauds. We want to make sure that our networks and everybody who's a part of them, as well as all people, are encouraged to report all COVID vaccine and other scams and frauds to the right sources. And you heard about some of those from Ed and from Lisa. We want to empower individuals to resist these scams and to deploy solutions to support recovery for those who've experienced them. And to hopefully empower them to recover what they have lost. And most importantly, when it's your turn, get vaccinated. Separate the facts from the scams, know what's what, but when it's your turn, get vaccinated. That helps each one of us individually, it helps our communities, our loved ones, and ultimately it's what's going to vanquish this pandemic. So with that, I thank you very much. And Chantel, back to you.
All right. Thank you so much, Hillary, for your presentation. We've now reached the questions and answers part of our program. So I'll ask all of our presenters to come back to their screen, but to remember to unmute yourselves when you are speaking. And again, if the audience have any questions, please send your questions to outreach@fcc.gov. And that's even after the webinar, you can still send your questions and we'll make sure that we get back to you. In the interest of time, I am going to try to summarize some of these questions that we have. You guys have had so many resources that you shared with our viewers today. And so what I'll ask each of you to kind of summarize everything is to share your top resource. So for Ed, that will be, your top resource to avoid scams, as well as what to do if you find that you are a victim of a scam. For Lisa, that would be your top resource to get all the information that you just presented to us. Your top resources for protecting yourself financially, and the same with Hillary, but specifically for a resource for older adults to visit about protecting themselves. So we'll start with Ed.
Thanks, Chantel. I think, we covered a lot of ground, and one of the best stops in terms of content on our website for COVID specific items is fcc.gov/COVID-scams. And really the FTC, who's not on today's call, but they've been serving as somewhat of an aggregator for complaint reports. So, reportfraud.ftc.gov is a great place to go and report if you have had a problem.
And for the CFPB, the resource I'd like to share is consumerfinance.gov/coronavirus. You'll find all the information about the COVID-related scams that I discussed, as well as the COVID-related financial protection for older adults and for anyone. So again, that's consumerfinance.gov/coronavirus.
And for the Administration for Community Living, likewise, we have a highlighted location on our website about COVID. It is for the aging and disability networks and advocates, as well as for, it's mostly directed to them, but there's information there for individuals as well. And it is acl.gov/COVID-19. I would also say on that website, and also on the FCC and CFPB websites, are all the information about the various places to report. And reporting is just so important to take out these bad actors and make sure that other people aren't also subject to the risk of being victimized. So those are some suggestions from me, but our place for information is acl.gov/COVID-19. And remember, I'm sorry, someone called in the middle of that. The elder care locator as a way to connect to just about all the resources we've talked about today.
It's hard to pick just one resource, right? Okay, just for our viewers, if you've already sent a question, just to reiterate, there will be someone to get back to you through the emails at outreach@fcc.gov. But we don't want to extend this this webinar past the hour. So I'll say this concludes the questions and answer session for now. However, like I said, just send any of your questions that you have to outreach@fcc.gov, and we will continue to monitor your questions there. To deliver closing remarks is Kayla Hernandez Ujoa. Kayla is the Associate Division Chief for the FCC's Consumer Affairs and Outreach Division. In this capacity, she provides strategic leadership with regards to planning, developing, and managing the division's consumer-facing outreach efforts and agency-wide projects. So Kayla, I see that you're already on, and you can go ahead and unmute yourself.
Great, thank you, Chantel. I'd like to start by thanking our speakers today, Ed on behalf of the FCC, Lisa on behalf of CFPB, and Hillary on behalf of ACL. There was a lot of information here that is really good to share with a lot of people. Some things that I just wanted to reiterate that stuck for me were, I love the idea of the placemats. I think that's an awesome way of sharing information with consumers because it's right there in front of you. The Elder Justice Toolkit, we all know lawyers. I think that's a great idea to share that toolkit. The information on the Centers for Independent Living also is something that I think we should share. On behalf of the FCC, I think some of the best advice regarding vaccines is to visit the website or call your local and state health department to find out the process for your state. As it was mentioned before, vaccines are now available. Each state has a different process for who should get vaccinated and when, and it's the best resource for information. I'd like to repeat information that was shared today. Everything is going to be on our website at fcc.gov under the events section for today's event. If there are any remaining questions, as Chantel said, please know that we will get to your question. If you have any additional questions past this event, please send them to outreach@fcc.gov. And I'd like to conclude by again stressing how important it is to share this information, because together we can all help other consumers either have a lesser chance of getting scammed or help them if they think they've been scammed. And with that, I'd like to thank everyone for attending today's webinar.